What's going on, guys? James here, and today I'm going to tell you about the 5 strangest medical conditions in the world. While I take you on a journey through these bizarre and highly interesting syndromes you've probably never heard of before, I'll give you my expert medical analysis so you can understand them better. You might be really surprised by what you're about to hear. You won't want to miss this. Number 1, if you are blue and are not a Smurf, you may want to pay a visit to your doctor. You may have a rare blood disorder called methemoglobinemia. Much like hemoglobin, methemoglobin carries oxygen. However, methemoglobin is not able to deliver that oxygen effectively to your body tissues. As a result, your skin turns blue. There are 2 types of this disorder, congenital and acquired. Congenital means you were born with it, and acquired means you acquired it from something. I'll explain both. First, congenital. Babies born with the congenital form of this disease lack a protein that normally converts methemoglobin into hemoglobin. As far as symptoms go, they don't usually experience any, just blue skin. In other words, the condition is benign for them. Adults experiencing the acquired form of this disease start to show signs and symptoms after exposure to certain medications like benzocaine, lidocaine, and prilocaine. In this case, there's treatment. It's a drug called methylene blue. It works by reducing the amount of methemoglobin in the blood. Number 2, do werewolves exist? Technically, yes. Hypertrichosis or werewolf syndrome is a condition where excessive hair growth occurs everywhere on the body. It can begin at birth or it can start later in life. It's important to note that hypertrichosis can produce 3 different types of hair: vellus, lanugo, and terminal. Vellus type hair is really short hair that grows no longer than 1/13 of an inch. Next is lanugo type hair. Lanugo type hair resembles that of a newborn baby's hair. In other words, it's just really soft and fine. And finally, terminal type hair. Terminal type hair is very long, dark, and dense. Next, let's talk about the causes of hypertrichosis. Hypertrichosis can be caused by a few things. First, it can be caused by a gene mutation. This mutation signals the body to produce excessive hair, and it begins in the womb as the child is developing. Second, it can be caused by malnutrition and cancer. Malnutrition and cancer both cause abnormal cell signaling. To explain, normally cells send accurate instructions to each other. However, if the body has cancer or is malnourished, those cells could send or even receive the wrong instructions. And one of those instructions could be to grow excessive hair. Third, hypertrichosis can be caused by anabolic steroid use because steroids increase sex hormones in the body to very, very high levels. When the sex hormone levels increase, they signal follicles to grow more hair. So can this be cured? Unfortunately, there is no cure for the hypertrichosis that's congenital and starts in the womb. There are treatments though. Treatments are aimed at shaving, waxing, and plucking. However, if the hypertrichosis is caused by cancer, malnutrition, or anabolic steroid use, it is reversible when the underlying cause is treated or the anabolic steroid is discontinued. Number 3, Abdul Bandajar was dubbed the Tree Man at the age of 15 after he started developing bark-like warts on his hand. He suffered from what's called epidermal dysplasia varicoformus. This is a very rare disease that can develop after someone contracts certain forms of HPV, otherwise known as human papillomavirus. I'm sure you've heard of it before. Girls get vaccinated against this in their teens. However, the strain of HPV that causes this condition is rarely seen in most parts of the world. Importantly, this disease causes the body to produce excess keratin and malignant skin tumors that resemble tree bark. The good news, however, epidermal dysplasia varicoformus is not an infectious disease that spreads from person to person. Instead, a combination of 2 things must happen in order for someone to suffer from this. Let me explain. To contract this disease, an individual would simultaneously need to be born with certain genes and at the same time would need to come in contact with a rare form of HPV. First, the person would need to have an EVER1 or EVER2 gene on chromosome 17q25. Let me break this down for you. EVER1 and EVER2 genes are mutated genes that do not allow your body to fight off certain forms of of HPV, also known as human papillomavirus. So basically, they're just genes that don't protect you like they should. The second thing that would need to happen is a person would need to be exposed to one of the rare types of HPV I mentioned. So with that said, if someone both had come in contact with this rare form of HPV and also happened to have the EVER1 or EVER2 gene, they most certainly would suffer from this debilitating condition. Number 4, teeth on your back, extra organs growing from your mouth. Yes, you heard me correctly. We're talking about teratomas. Teratomas are rare tumors that contain hair, organs, nails, teeth, and even bone. They're not too difficult to spot and can typically be seen on the tailbone or in the ovaries and testicles. There are usually no major symptoms associated with this condition besides possible swelling, bleeding, and some pain for most. Interestingly, if the tumor grows on the tailbone, it could cause some mild constipation and abdominal pain. Also, if it grows in the testicular or vaginal area, painful urination or mild swelling could occur. It should be explained that both newborns and adults could experience these tumors, but they primarily affect women. So when a baby develops a teratoma, it is usually benign. Treatment involves removing the mass. However, when adults develop them, they tend to be malignant and can grow back. Having said that, doctors need to keep a close eye on their adult patients to monitor for regrowth after they remove the teratoma. Number 5, imagine being drunk without consuming alcohol. Most of us get a buzz on by drinking an alcoholic beverage, but what if you could be intoxicated without drinking? Shockingly, some people can do that. It's a condition called auto brewery syndrome. Yes, you heard me right, auto brewery syndrome. This is where excess ethanol, otherwise known to most as alcohol, is produced in the gut after consuming sugary or carbohydrate-rich foods. This is because of a certain type of Saccharomyces yeast overgrowth. Usually, when we consume food, the gut bacteria help break it down and release helpful byproducts. However, when someone has auto brewery syndrome, instead of the gut bacteria helping, yeast takes over and produces excessive amounts of ethanol instead. As you could imagine, symptoms of this disease are what you would expect. Feeling drunk, hungover, lethargic, and of course bowel problems like constipation and bloating. Fortunately, people can manage auto brewery syndrome through diet, exercise, lifestyle changes, and antifungal therapies. For example, cutting out high carb and sugary foods, exercising more, and of course antifungal medications to get rid of the unneeded yeasty inhibitors. That does it for today. If you enjoyed this, please share this video, like this video, comment on this video, and make sure you hit that bell in the bottom right-hand corner to be alerted for when I post new videos.